All right, so for our public service announcement video, we are doing exertional heat illnesses.
So the first one is exercise-associated heat cramps is the mildest form of heat illness. Athletes present with painful contractions of skeletal muscles when temperatures are hottest and at time when the athletes are least conditioned. The area that's most affected is the calf muscle, but can be any smooth muscle not involved. It's not related to body temp or dehydration, but more muscle fatigue and electrolyte imbalances. The best treatment is prevention with proper fluid ingestion days and hours preceding exercise, during exercise, and in diets. An article I found called The Exercise Associated Muscle Cramps in Tennis Players explains that there hasn't been any recent studies evaluating tennis specific risk factors, but tournament conditions expose players to a longer duration of play and increased intensity associated with acute localized cramps due to muscular fatigue. Also, the nature of tennis varies on the match length, increased thermal environments, and playing multiple competitive matches in a single day can increase difficulty maintaining hydration status and adequate sodium levels during and in between matches. Heat cramps can also be a warning sign of more serious related illnesses like heat exhaustion and heat stroke, but it's also important for healthcare and athletic trainers because it can affect the athlete's performance, safety, and well-being. Also, being able to recognize the signs and symptoms of heat cramps like intense pain, persistent muscle contractions, and reduced performance. Also, treating heat cramps by moving the athlete to a cooler place, giving them the fluids and sodium, and stretching the affected muscles. Also, this should change the way we practice by making sure to monitor the athlete's recovery and return to activity, as well as educate the athlete on how to avoid heat cramps in the future.
So next we'll go over exertional heat exhaustion. So why does this happen? Inadequate replacement of fluids lost through sweating and or poor physical conditioning causing fatigue. Some signs and symptoms of exertional heat exhaustion include cramps, disorientation. The patient presents as lightheaded with their skin pale and cool. They're sweating, they have nausea, severe thirst, and headache. Treatment for this would be stop exercising immediately, replace fluids immediately with things like water and sports drinks. You'd want to elevate the patient's legs, cool them with ice and wet towels, of course, water immersion, and then the patient may need medical attention if there is no improvement after attempting to treat. So for this discussion, a significant text I was able to find was Epidemiology of Exertional Heat Illness in NCAA Athletes during 2009 to 2010 through 2014 to 2015 academic years that was published in 2019. So basically, this article goes over exertional heat illness in sports, stating that football players experience the most exertional heat episodes compared to other athletes in all other sports combined. Um, Exertional heat illnesses occurred in almost all NCAA sports, is what this article went over. And then also statistics show that exertional heat illness mainly occurred in preseason practice due to the higher temperatures in the preseason months. So why is this topic important? Exertional heat exhaustion is an important topic to discuss due to the fact that it could potentially save a life and prevent permanent damage in your athletes. And then how does this change the way we practice? So as clinicians, events like this create standards to enforce among our athletes to ensure prevention. And it also sets a higher standard for us as well to ensure proper recognition and treatment.
So going next to heat stroke, exertional heat stroke is the most severe heat-related illness, and this occurs when the sweating mechanism fails, therefore is unable to cool the body, and it could also be due to the environmental heat. And the body during a heat stroke can get to temperatures of 105 degrees Fahrenheit or above. Some symptoms include confusion, nausea, headache, rapid pulse, and a loss of consciousness. If someone does go through heat stroke, the first thing we should do is call 911 and to get the patient to the hospital as soon as possible. And in the meantime, we should get the patient into a shady, cool area, remove any excess clothing, and cool the patient down. Heat stroke is the leading cause of death in athletes in the United States, where 61 deaths among American football athletes were reported from 1980 to 2014. And while 61 deaths within 34 years seems like not that much. I believe it's better to have 0 deaths rather than 61. A research article I found said that a 2017 study was performed on American high school football teams where 910 athletic trainers participated in, where they were asked about their preparedness strategies in case of an exertional heat stroke. And some of these strategies included hydration access, emergency response plan enacted for school athletics, policy with instructions for EMS response, train athletic staff for recognition and treatment of EHS, immersion tub filled prior to practice, and a monitor wet bulb globe temperature, with hydration access being the most common, and immersion tub being filled prior to practice, and monitor wet bulb globe temperature being the least common. And all 6 I'm sorry. And I believe this topic is important since we, as future athletic trainers, certified athletic trainers, it is important since we should be prepared in case of these types of situations. And in order to get as least deaths as possible from a heat stroke. And something interesting I found was when heat stroke is treated immediately and core temperature is normalized within 30 minutes, there's a 100% survival rate. And the fastest way to decrease core temperature is with cold water immersion therapy. And this I found interesting since even though it's been proven to be one of the most effective in the 2017 study, it was also one of the most least commonly used strategies. So I think it's something we should use more.
Perfect. So our next illness we're going to talk about is heat syncope. So heat syncope is a fainting episode or feeling dizzy or lightheaded that often occurs from standing for too long in hot temperatures or the result of dehydration from physical exertion. So something about heat syncope is it often is due to like either standing for long periods of time with thick amount of clothing. So we want to think about our football players who are staying on the sidelines in hot weather with all the pads and clothing. They want to make sure you have breathable clothing as an athlete. So that is something to keep in mind. Some ways to minimize symptoms is to sit or lie down in a cool place. Often the athlete's legs are elevated. They have ice packs, fans, anything to help cool them down. They often will probably look pale, sweaty, and have a decreased pulse. So that is something to monitor while they are trying to regain feeling better. They also want to start slowly drinking water, juice, or any sports drink to help rehydrate them, kind of get their electrolytes up and help try and balance whatever symptoms they're feeling. Things to note about heat syncope is that it often occurs when athletes are unacclimated to the heat or the weather conditions. It takes about 3 to 5 days for an athlete to feel acclimated to whatever weather that they're in. So when it comes to traveling or coming to new places where the athlete might not be used to the heat conditions, it's important to keep that in mind as the athletic trainer to increase their water intake, really make sure they have cool towels, and really just pay attention to any heat illnesses that they observe. An important thing to note as an AT is heat syncope is something that could be something that is worse, as in we want to make sure that they're not experiencing any cardiac event or anything that could be more severe than just heat syncope, because that could lead to a medical emergency that needs to be taken care of. So as the AT, you are in charge of really monitoring any heat conditions and making sure that it's an appropriate weather for the athlete to participate in. And that would be using like the wet bulb globe, like we talked about, to really assess the conditions outside and make sure that it's safe for the athletes to participate.
The last heat illness is exertional hyponatremia or exercise-associated hyponatremia. Exertional hyponatremia is rare but can still happen. It is caused by having a low amount of sodium in the blood. How can this happen? This can happen when an athlete drinks too much water and does not drink enough sodium, causing an imbalance within the body. They are replacing the fluid loss, but not necessarily the electrolyte loss that can happen when these athletes sweat during exercise. Hyponatremia disrupts the fluid balance across the blood and brain barrier. This results in a rapid influx of water into the brain, which can cause swelling of the brain and severe neurological responses. Signs and symptoms can include rapid weight gain, bloated stomach, swollen hands and feet, nausea and vomiting, headache, dizziness, severe fatigue, lack of coordination, restlessness, confusion and being disoriented, wheezy breathing, and seizures. This is a medical emergency if not addressed right away and can be fatal. So if there is a combination of the above signs and symptoms, then EMS needs to be activated as soon as possible. As certified athletic trainers and athletic training students, we need to be educated on proper hydration so we can share these facts with our athletes, especially since we do live in San Diego where it is always sunny and warm all year round. On hot days that athletes do have practice, then we can prepare by having sports drinks and handing out Medi-Lite packets. We also need to tell athletes that they should be hydrating throughout the day and not just as soon as they get to practice, as that will rapidly increase the amount of fluid that is in their body, causing that decrease in imbalance of sodium. We also need to pay attention at all times. If athletes are heavy sweaters, then we need to take note of that as they are sweating out fluids and sodium. We need to keep an eye on them and push extra fluids and electrolytes to keep that balance within the body.
Okay. So these are references, and that's our presentation. Thank you.